Ladies and gentlemen, if you're feeling sick and tired, let me assure you, you're not the only one. Half my team is down with fever and headache and extreme fatigue. Question is, could it be COVID driven by the new JN1 strain? Now, that is a question only a lab can answer. But given how close the symptoms are of common flu and given our experience with COVID, most of us are not even bothering to check with a doctor. But here is something we need to know. We need to know that there is a surge in COVID cases in India. 614 cases have been reported in the last 24 hours, which is the highest since May 21. Which means COVID cases in India are on a 7-month high. Now, most of them are being reported from Kerala. In Kerala, there have been 5 COVID-related deaths as well. Now, of course, the one question that most of us will ask is, how many of these cases that are being reported in India are being caused by the new variant? 21 cases is the number right now. Most of them, 19 of them in Goa, have been zeroed in as JN1 cases. Now, this is the very same variant that has been causing a spike in COVID cases in the US, in Singapore, in China as well. JN1 was first identified in Europe's Luxembourg, and it is a descendant of the Omicron variant. It has now been classified as a variant of interest by the World Health Organization. Here's the truth. We don't know an awful lot about it, except that it is mild and it is causing extreme fatigue. In the light of the current surge, the Health Minister has chaired a key meeting today. Mr. Mandviya has asked the states and union territories to be vigilant. He has advised them all to send samples of all positive cases to the INSACOG labs. These are labs which essentially will determine if these cases are cases from the new variant or the old one. Now, Karnataka, much like Singapore, has already asked its citizens to mask up.
आज की सिचुएशन ये है कि देश में एज पर आवर रिकॉर्ड्स लगभग 2300 एक्टिव केसेस हैं और ये भी देखने में आया है कि इस बारी जो आउटब्रेक है वो हो सकता है कि एक सब टाइप है जो BA 2.86 का वेरिएंट आगे जो स्वरूप लिया उसने सब टाइप है JN.1 उसकी वजह से ये अपसर्ज हुई है। कोई घबराने वाली बात नहीं है पहले तो, क्योंकि इस वेरिएंट की जितनी भी अभी तक समझ है फैलने की क्षमता रख रहा है, लेकिन माइल्ड डिजीज़ करता है, खांसी जुकाम ही करता है। सीरियस डिजीज़ का इसका स्वरूप अभी तक जितना हम जानते हैं बिल्कुल नहीं है। और जो भी डेथ्स हुई हैं पिछले 2 हफ्तों में टोटल 16 डेथ हुई हैं टोटल, वो लगभग उन्हीं व्यक्तियों में हुई हैं एज पर आवर रिकॉर्ड्स एंड इंफॉर्मेशन जिनमें की सीरियस कोमॉर्बिडिटीज है।
Basically, they have asked us to continue our preparation, keep vigil, increase our testing, and ensure that all oxygen and beds and ventilators and all that is all in place. And any major outbreak, the government should be prepared to handle it. But they are saying this variant has been JN.1 variant has been around for almost few months now across the world, and there's no need to panic. It's a subvariant of the Omicron. So just keep testing more. Karnataka is now the highest in India in number of tests in the last 24 hours. So we have a target of increasing it to 5,000 by Saturday.
Okay, as I said, we don't know an awful lot about the new variant, but there is someone who knows an awful lot about COVID, Dr. R.R. Gangakhedkar. He's a former head division of epidemiology at ICMR. He's joining us on the broadcast. Dr. Gangakhedkar, thank you very much for your time here on Mirror Now. Can I start by asking you what we should make of the J1.1 subvariant that everyone is talking about? It has already by WHO been declared a variant of interest. What is it that we should know?
No, variant of interest essentially means that the proportion of people getting this infection is increasing significantly. it is also getting transmitted in different countries. And this JN1 virus variant that we are seeing is, you have to just keep a watch on it because we don't know much about its severity. And there is no reason to believe as of now whether the severity of the disease will increase, whether it is going to impact hospitalizations and death. And therefore, it remains under as a variant of interest.
Okay, Dr. Ganga Khetkar, often even when we were in the times of COVID, we were told don't panic, be vigilant. But panic is good in a situation when you have a festive season coming up. The government of India has already gone into a huddle. Fact is that Karnataka is one state that is already asking people to mask up. Should we, at this point of time, at least start taking fever and cold and headaches and fatigue a little more seriously than we were in the last 6 to 8 months?
No, we need to be vigilant in certain groups of populations. No, those who are older, those who have chronic morbidities, they have to take care. When we do not know that the severity is not increasing with this, no, one needs to be vigilant. So we will follow COVID appropriate behavior. We will have to ensure that if I go outside, if I belong to that risk population, I must wear my mask. I must try to ensure that I don't all the methods that we use to describe them. We need to ensure that we don't we reduce the risk of acquisition of this particular infection.
Dr. Ganga Khetkar, is there a headline symptom that all of us need to take care of or be vigilant about? Because for the moment, it seems like the symptoms for the new variant, that is JN.1, seem to be pretty similar to its parent, Omicron.
Yeah, most of the symptoms are similar to Omicron variant. The only thing that perhaps is getting more reflected is most of them tend to have more of nasal symptoms rather than symptoms that would be related to respiratory system, like dyspnea, that is breathlessness, or cough, which would be predominant. No, that feature is not being seen. There is no major difference between Omicron and this particular variant when it comes to symptoms at this juncture.
Okay, what about immunity from vaccines? Will the vaccines, will the 3 rounds of vaccines that we all have injected into ourselves, will that give us immunity, or will we have to go for an upgraded vaccine if JN.1 becomes a cause of concern?
I don't think we may be required to go for the fourth vaccine per se. There is very little data on vaccines efficacy, and whatever data that is coming against this particular variant is coming from the developed world, where they are using mRNA vaccines, where different variants are also becoming constituents of those vaccines. There they are saying that the risk is reduced by close to about 70% when it comes to acquisition. But does this mean that we will have to go for a newer vaccine? We at least don't have a vaccine which is based on this newer strain per se. So should we be panicking? Absolutely not. I think it would be better to wait and watch as of now rather than getting worried whether my vaccine is going to be protective or not.
But there has been some worry in some other parts of the world, sir. China, for example, you had children being hospitalized. In Singapore, they have already mandated for masks in public places. In fact, even in Karnataka, a mask mandate has been put for senior citizens. What is it right now that people in our country who are watching should know, given that the festive season is around?
Yeah, what is most important is at least those who belong to risk groups, no? The old age population, those who have chronic morbidities, they must avoid going to such functions where large gathering could perhaps be there. Even if they are going to go, they must ensure that the mask is worn by them all the time. If you are going to go and stay in any air-conditioned rooms, no, in those circumstances, we need to take care that our mask is always protective. Beyond that, should we be worried more? China's outbreak was of a different kind. The children who were getting admitted were suffering from three different viruses and bacteria, which was causing it. Was that a cause of worry for us? Perhaps not. If you talk of Singapore and such places, one thing which we must remember, everybody is trying to take abundant precaution because this is a virus which will not go so easily, and the virus keeps on mutating. So instead of taking risk, everybody is trying to take steps to prevent the transmission of this virus so that the numbers don't become too big. As of now, even in US, 1 in 3 cases are occurring because of JN1 virus. So we need to be cautious, and that should not be interpreted as a reason to panic.
All right. Dr. Ganga Khedkar, always good to speak to you. Thank you very much for joining us. Also joining me this evening, Dr. Sanjeev Bagai, Chairperson of the Nephron Clinic. Dr. Sunila Garg is Chair of the Program Advisory Committee, NIHFW. And Dr. Asmita Mehta is Professor and Head of Respiratory Medicine, Amrita Institute of Medical Sciences, Kochi. Thank you, ladies and gentlemen, for joining us on the broadcast. Can I start by Dr. Bagai and asking him whether he's had any encounters with the new variant? And if yes, Dr. Bagai, what is that one headline symptom that we need to look out for? Of what I have been reading from the experiences of the US and of Singapore, it seems it's extreme fatigue that differentiates it from symptoms of Omicron.
Good evening. So JN.1 is a descendant of BA 2.86, which is one amongst the Omicron variants. The sublineages are approximately more than 1,650 so far, and this is the newest one. And this is a convergent mutation. That means it gathers a very nasty mutation, which is L455S, which gives more immune escape. Its immune escape is not only for double vax, triple vax, or 4-vax, but also having a higher breakthrough infection and reinfection. As far as symptoms are concerned, there is a very large study which has recently been published in Lancet of 1.5 million patients which have shown BA.2, which is one amongst these variants, having more symptoms than BA.1, the previous parental lineage of Omicron. The classical ones which have been described is fever, chills, persistent new cough, and extreme fatigue. But having said that, India, because of its very good and robust vaccine campaign, even though it's for the ancestral strain, is reasonably well protected. There is also recent data, very quickly to tell you, that even though the neutralizing antibodies which are induced by the vaccine have diminished because of this immune escape of JN.1, there is enough binding antibodies and cross-reactive T cells, your other arm of immunity, to protect us as a community. Wear your mask, do not self-medicate, do not hesitate to get yourself tested. If there are early symptoms, just like a cold or cough or common flu, isolate yourself. Don't take antibiotics unnecessarily. Don't take heavy painkiller medicines and fever medicines unnecessarily. Comorbidities, specifically elderlies as age above 65, chronic kidney or liver disease, hypertension or coronary artery disease, or immunosuppressed individuals need to be specifically careful. Masks will still save you even now.
Masks will still save you even now, but there is no advisory or mask mandate in the country so far, except in the state of Kerala. Is it time for us, given the fact that we have a festive season coming up, Christmas and then New Year's, is it time to put that mandate in as well? And if we do that, will that cause panic? Dr. Sunila Garg, fact is, COVID had become COVID because of the sort of hospitalizations it had required. When we are talking about the new strain, we are not talking about hospitalizations because the symptoms seem to be mild. In that sense, should we say that, okay, this is just one of the variants? It is much like a cold and cough. And while it's okay to be vigilant, there is no need to panic. There is no need to start talking about an upgraded vaccine.
Thank you, Shreya, first of all, for having me on the show. Number one, I would like to tell you that when we detected this variant was just because of routine surveillance as part of INSACOG. And we have to remember that, this was detected in a 79 years old lady. And predominant symptoms which are going to be there in this case are, not like, cough, cold, fever and all, but it presents more like a severe body ache, joint pains and all that. And the other symptoms are subsequent, when we talk of, acute respiratory like symptoms and all that. And this virus has got predilection more for lungs. That is one thing which we have to remember. So this the persons will present more with the symptoms like pneumonia and all that, if it is in the severe cases. But one thing is there, it spreads very fast. It escapes the immune response. But as of now, what we are seeing are of much milder nature. So that is where we need to be vigilant. And as you pointed out, masks also had never gone out of our lives. That is important thing which you have to remember. So we could see that mask mandate was not there, but we always made it this thing that elderlies and people with comorbidity should be wearing masks. So as of now, when we see that, since this virus is fast spreading and we can maintain a distance of at least 1.5 meters, especially amongst individuals who are more vulnerable. But we should always watch for, surveillance in influenza-like illnesses or severe acute respiratory infections, the cases which are coming. So our surveillance system has got to be very strong. So that's how, we can monitor the situation. We have to also monitor our hospitalizations and look at the type of cases which are coming. But then also, we had, people taking 2 doses, about 220 crore doses were given. But also we need to see that, people who did not receive their boosters should receive their boosters. That is important part which we have to remember. But as you said, virus research has to, this vaccine research has to go on regularly. But we need to see, as of now, we need to be worried about that.
But Dr. Garg, will that booster dose work against a newly mutated variant?
You see, that
because it was meant to deal with a certain type of variant, and here we are dealing with a completely different beast.
No, definitely. This is a Omicron variant, which also existed earlier. And if you will remember, during Omicron wave also, our earlier vaccines, they worked. So that is important part which you have to remember. But as I said, that vaccine research must go on, because as long as virus is there, it will mutate and it will continue to change its character. So when we talk about the 4th dose and all that, but before that, we have to talk about the 3rd dose. That is important because it always provides, the cross immunity also.
Okay. Also, the government of India has already had a word with Bharat Biotech, Dr. Asmita Mehta, for an upgraded version. So let's see where that goes and let's see how serious this concern becomes. But fact is that India is seeing a surge. The WHO, Dr. Mehta has already declared this a variant of interest, which means that the surge that is happening is significant. It is not something that you can simply brush under the carpet. My question to you is this: maximum number of cases in India, actually, in the last 24 hours, we have recorded a record high as far as COVID cases are concerned. It's on a 7-month high. Most of them in Kerala, yes. But when it comes to JN.1, it seems that most of them, 19 out of 21, are in Goa. Are we to assume that all the cases we are seeing in Kerala as well will belong to this variant and no other?
So thank you so much for giving this opportunity to talk on your show. And as you rightly said that, yeah, Kerala tops in everything. Even the first case of Kerala when came in India in 2020 was also reported from Kerala. And somehow we are always in something which is very notorious that we will be the first one. The only one case which was reported, the first case was from Kerala, and that particular lady, as Madam said, was quite well, and she is actually recovering and she's perfectly all right. So what is going to happen is what INSACOG has told is all the positive cases which comes, we have to send to that institute for finding out the strain. And if the data comes out in near future, and if those cases which are belonging to Kerala are positive and positive for that strain, because as sir told, Gedkar sir said, around 15 to 30% of the cases. So I won't say that all the cases which are happening in Kerala or COVID cases are belonging to this particular variant. Hardly 30%. Maximum is the 30% all over the world, and that is what we can expect also from Kerala. Having said that, I belong to Kerala. I belong to one of the largest tertiary care hospital, and we are actually not seeing any serious cases till now which can make us panic. So I will also stand by all my colleagues which are saying that it's better to be vigilant but not to panic.
Okay, so Dr. Mehta, since you are dealing with patients who have this new strain, can I ask you what the typical symptoms are? I know everyone on this show has already spoken about it, but is there something extraordinary that you're seeing that you didn't see with other variants?
So the predominant feature which we are seeing now is headache. So any viral illness which will come, and this is particularly patient will come with a runny nose and all that, those things are very common, but the headache and the post fever or post remissions fatigue. So they will typically tell that they feel breathless. And when we auscultate or when we find out they are not actually breathless, they are tired, they can't do any work, they sweat a lot, and almost any effervescence or any fever which gives you fatigue, but this fatigue is slightly different, and patient will typically tell you that they feel extremely tired. And the predominant feature which everybody tells is about headache, which is very typical of this particular variant.
And how much time is it taking for people with this variant to get cured?
So cure is something which we have to say when the COVID came first. That time also we were in concern that should we do RT-PCR negative, and also I would rather be worried about my patient doing well rather than labeling them cured, that okay they became negative. It will be concern for the authority because they might think how many patients or how many people they will infect afterwards. So we should be worried about the infectivity period of the patients who are developing this particular COVID. But if it is the way it is happening till now, and it is even the variant of interest is not variant of concern yet. So it's not serious illness as of now, and I will not be worried about cure if my patient recovers within 4 to 5 days. That is what is happening to most of the patients. So if 4 to 5 days is the illness, and then we can just say them to take all the precautions for next 5 to 10 more days and wear mask and keep the distance, whatever. I think we have graduated in COVID, isn't it? Like the first wave, second wave, third wave, it just goes on. So we are almost in the level of PhD now. So I think we know what to do. And even government says or not says, as a correct citizen, we should be taking all the precautions to protect ourselves, protect our family, and protect our public.
What you say rightly, Dr. Asmita, is that we have become PhDs in curing ourselves as well. And that is something that Indians love to do. Don't go to a doctor, everything is available in the kitchen, and that sometimes is not a good idea, which is why I'll ask the doctor on the panel, Dr. Sanjeev Bagai, when is it that patients need to consult a doctor? देखिए सर दर्द तो मेरा अभी भी हो रहा है. And half my office has an headache, but we sometimes peg it down to migraine, we sometimes peg it down to stress. Again, fever, half the people I know are down with fever. In Delhi, most people are saying, "Arey, this is badalta mausam. This is a weather change. In this season, headache to hoega hi, fever to hoga hi." At what point do we need to call the doctor and say, "I need help"?
That's a good critical question, because in at least the northern India in winter, you have not only the cold temperatures and the viral shifts. We've seen a lot of influenza these days and other upper respiratory infections. It's also the pollution which gives headache and other fatigue-like symptoms.
Correct.
So any fever which is there crossing more than day 2, any fever which is more than 100 to 101 grade, any dry hacking cough, any extreme fatigue, or indeed breathlessness, consult your doctor. Now, there are two choices. The earlier choice was to do a rapid test at home, which is the RAT, rapid antigen test, in which this particular variant will have a greater fallout. That means more number of false negatives. But your RT-PCR will still give you a positivity rate of 60-70%. But the main thing which you need to do is to wear a mask and isolate yourself. The infectivity period for all Omicrons, including GN.1, is approximately 7.5 to 8 days. So the earlier prophecy of 5 days is inadequate. At least 7.5 to 8 days isolation is important. You can continue to shed the infectivity virus even for 7 to 8 days. This virus is milder than the Delta. But in the last 30 seconds, just to explain, this is the part of a group of mutations called as flip mutations. So what these mutations do is they have a mirror image of the amino acid changes. So they can very rapidly evolve, and even this GN.1 has now subgrouped into 5 or 6 different types. So we need to be vigilant. Your earlier protection of vaccines are holding. I'm not too sure of people who've got only 2 vaccines, whether the third dose of the ancestral strain will work that well, perhaps lesser, but the vaccines are still holding. Your still protection is common COVID-appropriate behavior. A rider, which I must add, people jump into antibiotics very quickly. Please resist from doing that. Consult your doctor and then embark on your treatment.
Okay, so consult your doctor before jumping onto antibiotics. We love to self-prescribe. India loves to self-prescribe. I mean, even I love to self-prescribe. Who will go to a doctor? We know, this is our body. We know how to treat it. If it's a headache, simply eat a Saradon. That's how we deal with most of our minor illnesses. What you're telling me is, there are 2 things, actually 3 things that I'm taking away from this conversation. Number 1 is, what are the headline symptoms? The headline symptom is, ladies and gentlemen, actually a headache. If you have a persistent headache, you cannot explain. It is probably something to do with COVID and something to do with the new variant we are talking about. Second, extreme fatigue. If you have headache combined with extreme fatigue, probably you don't need to do an RT-PCR. This could be the new strain. Should you call a doctor? Yes, you should consult a doctor, get some medicines in, but get those medicines in only after consulting a doctor. Meanwhile, isolate yourself. That is important. As I quickly wrap this chat, can I just ask my guests for one piece of advice, apart from masking, that they would like to give fellow countrymen who are watching this broadcast and probably saying and thinking to themselves, hey, Bhagwan, is COVID back? Dr. Asmita Mehta, I could start with you.
Yeah. So one advice to all of you is please hydrate yourself, and please follow hand hygiene. So if you follow these 2 things, hydration and hand hygiene, half of your problems will be taken care of.
Dr. Garg?
Yeah. I'll also recommend hand hygiene. That is important, and particularly for comorbids and for elderly people to avoid going to the crowded places. That is important.
And Dr. Bagai?
I mean, my mantra is always ventilation, ventilation, and ventilation. Keeping adequate distance between person to person. 1 meter, what was earlier said, is again inadequate. At least 3 meters distance. Ventilation is something which will prevent most respiratory airborne diseases.
Okay, Dr. Bagai, we'll leave it there for the moment. Thank you, Dr. Garg, for joining us. And thank you, Dr. Asmita Mehta, for joining us as well.
Thank you.
So again, as I wrap, the advice from the good doctors is this: keep hydrating yourself. It is very important. Maintain high hand hygiene. We have thrown away our sanitizers somewhere, wherever they are, fish them out, put them back into your lives. It could probably help save some lives. So that's 2. Hydrate yourself, ensure that you have hand sanitation, and thirdly, for heaven's sake, if required, do mask up, especially if you have the elderly in your family, and ventilate, as Dr. Bagai says. Thank you very much, ladies and gentlemen, for joining us. This has been an educative discussion. I hope our viewers have taken something away from it. So don't panic is what the doctors are telling us, but be vigilant, because COVID is back in our lives. It's mild, but it's back. For the moment, I'm slipping into a quick break on the show. There's much more news coming up on the other side. Do stay with us.